This week marks 1 year since the 988 Suicide and Crisis Lifeline was launched. It was a change to make it easier for people in need of help to reach out and speak with trained professionals about what they're going through and ultimately to save lives. It is a simple 3-digit number, but we're going to leave it on the screen for anyone who may be in need of someone to talk to. And joining me live in the studio now is Rachel Morrison. She is the director of the 24-hour Crisis Hotline and Counseling Program. So Rachel, first of all, thank you so much for joining us.
Thank you for having me.
Well, before switching to that 988 number, the National Suicide Prevention Line was a 10-digit number, difficult to remember. And looking back on that first year, how would you say that change is being felt? Because I know the old number is still live, but are more people finding the 988 number and using it?
Oh yes, we've almost doubled monthly in calls from our normal calls that we used to get on the National Suicide Prevention Line before the changeover. We used to be about maybe 300 or so calls a month. Now we're 450 to 500 calls a month.
Wow, that's a great increase. Now, regardless of what number is used, we know it is an extremely important service. If you would, talk us through what people can expect if they decide to pick up their phone and dial 988.
They can expect to have a live professional counselor on the other line to speak with them to help them get through whatever crisis they may be going through. So it's not just a suicide crisis, but mental health. We're there for support and also to give resources for whatever their crisis is in need.
Sure. When people are in a time of crisis, though, going through some kind of medical emergency, it can be really hard for people to know in that moment that resources are even able. And now that you've simplified the National Lifeline, what kind of awareness efforts have you conducted and still continue to promote to let people know that you're out there and you're easily accessible?
Well, there's periodically campaigns that are going on media, also puts the number on our website, all our social media platforms talk about, dialing 988 just along with crisis services, our main number.
Anonymously picking up a phone and talking to someone, it works for a lot of folks, but others may respond better sitting down face to face. What other services like that are available for someone who may be watching tonight or knows someone that might benefit from that kind of environment?
We give resources for that, and we are a comprehensive agency, so we have other sources, other resources and programs that are available for folks at our agency. But we're also able to give that face-to-face type of referrals as well if someone does need that. But most times people really find that talking on the phone to someone kind of is a little easier. You don't know the person and you can't remain anonymous.
Yeah, I think there's a certain, comfort in that anonymity. It's Friday. Hang with me, Rachel. Tell me a little bit, though, about the stigma being somewhat relieved, because once upon a time, there are a lot of people who felt like, this is the kind of thing you keep to yourself, or maybe just confide in your pastor or a priest or a close friend. Is that stigma somewhat diminished now? Because it seems like there's more awareness and more national conversation about mental health issues.
Yes, it has eased a bit. I think we're kind of at a state where we don't have any choice a lot of times. COVID did a lot of backtracking and a lot of having people kind of think, what type of resources do we need? What type of services are out there? And we're talking to your family members, your friends, or just strangers, and they're like, I kind of feel the same thing. I feel a little depressed. I feel like, isolated. I need someone to talk to. Mm-hmm. So I think that it's kind of diminished the stigma and kind of allow people to reach out and get some help.
It seems like younger people now, just judging from social media, whether it's Instagram or Snapchat, any of those forms of social media that young people are into, it seems like there's more information than ever. Is there another group, like maybe senior citizens or older groups, that you still struggle to reach, that still feel a little bit marginalized, like they're not comfortable coming out? And are there any special efforts that you do to maybe make those people more comfortable with using your number?
Yeah, I don't know. I don't think so. I think we have such a wide range of folks calling the 988 line as well as our 834-3131 crisis line, from all ages, demographics, you name it. So I think along with that stigma and along with 911 being more publicized and crisis services more publicized, and in areas like this, that people are able to reach out now way more than they have been in the past.
Yeah, I mean, there are so many obviously terrible things that happened as a result of COVID, but I think maybe, I don't know if you agree, that one of the benefits maybe is people coming out more and talking about their feelings of anxiety and isolation. Do you feel that that was a little bit of a shift?
Yes, because people were not kind of aware of what could actually happen if you are isolated, if you were getting services for a type of a mental health, or you know someone, and then being in the house and being isolated kind of said, whoa, we didn't know that it could be this bad. We didn't know that things can be this tough to reach out. So now we're going to take advantage in case something else happens that we have no control over. So.
Yeah, absolutely. Well, we appreciate your sharing your insight and perspective on it. Again, Rachel Morrison, she is the Crisis Prevention Director, correct, with Crisis Services?
No, I'm the director of our 24-hour hotline, our crisis counseling program. So, yes.
All right. Well, we'll be punishing our producer for getting that wrong.
That's okay. And
I'm kidding, Dan.
Over the 988 hotline, and the other lines are encompassing in our 24-hour hotline.
Well, it sounds like you're a very busy lady, and we appreciate your time today. Yeah, absolutely.
Thank you. Thanks for having us.
Absolutely. You're welcome.